tardes. Thank you so much for joining us all day today. My name is Yvette Sanchez Fuentes. I am the former director for the Office of Head Start, and it's my pleasure to be moderating this panel. I'm also a member of the Region 9 Head Start Association Board. Our goal today for this closing session is to hear from two state policy leaders, but more than that, two amazing women who have been in the field of early childhood and have dedicated their lives and their careers to ensuring that children and families get what's absolutely best for them. I hope that you have found today's conference to be informative, and I want to challenge you to commit yourself to two things. One is take back some information that you've learned to one of your colleagues who couldn't join today, and two, take something that you learned or heard today and try to implement it in what you do tomorrow. Because we all know that when you actually do something or have that hands-on experience, it stays with you. So before we go on, I'd like to thank our sponsor, Discount School Supply, for supporting the Region 9 Head Start Association year-round and for their support of local programs with products for our early Head Start and our Head Start programs. Please take a moment to watch this quick video, and then we'll move into our discussion. So it's my pleasure to introduce to you today our two panelists, and as I mentioned, two amazing women, Marilee Delprat and Camille Maven. So Marilee Delprat is the Chief Executive Officer for First Things First. Prior to joining First Things First, Marilee was Vice President for Programs at the Virginia G. Piper Charitable Trust, where she led the foundation's community initiatives and strategic program development. She was a driving force behind efforts such as Read On Arizona, the state's third grade reading initiative, Azteca, a multi-state partnership that supports early childhood systems building, the kindergarten experience that provided professional development opportunities to kindergarten teachers statewide, and Maricopa Family Support Alliance, a collective of 70 independent agencies that work together to serve families. Previously, Marilee served as the director for the Governor's Division for Children, where she coordinated policies and programs to improve conditions for Arizona's children and families in partnership with professional organizations, business groups, and policymakers. Thanks, Marilee, for being with us. In December of 2012, Camille Maven began serving in her current role as Executive Director of First Five California. In that role, she is responsible for staffing the California Children and Families Commission, in addition to directing the work of the agency and its staff. Through her leadership, First Five California is implementing several evidence-based and results-driven signature programs targeted to children, parents, and teachers that focus on quality. Prior to her appointment at First Five, Camille served as the Division Director of the Child Development Division at the California Department of Education. Part of her responsibilities in that role included providing leadership and oversight to over 700 early care and education contractors with a $1.7 billion budget. She was previously appointed by the governor to serve as Chief of Staff for the Office of the Secretary of Education. Thanks, Camille, for being with us. Marilee, could we just kick off with you telling us a little bit about your organization in Arizona?
Certainly, Yvette. Thank you very much. First, I'm just privileged to be with you all here today and with this extremely esteemed panel. These are incredible women who have definitely devoted their lives to young children and families. First Things First is very similar to First Five California in a variety of ways. We were created by the Arizona voters to create a designated revenue source in Arizona that was particularly focused on children 0 to 5. That was very important because our state had a very, we call it the Arizona two-step, 2 steps in investing in young children and 1 step back. So it was really important. Our voters understood the critical years, early years, and why it was necessary to have designated funding for that purpose. Our mission is very similar to First 5, is focusing on the population of children 0 to 5 and ensuring that they have all the needs met. And by statute, we're here to create an early childhood system that addresses all the needs of the diverse children in our state. Shortly after First Things First was created, then Governor Janet Napolitano designated First Things First to be Arizona's state advisory group under the Head Start Act. And our partnership with Head Start has really lived on through our entire history, and it's a very important collaboration to us. For those of you who may not know, Head Start in Arizona, we have 11 regional programs, 1 migrant program, and 13 tribal programs here. Our funding, different than First 5 California, and why I envy Camille a lot, is our funding that's generated through a special tobacco tax is really primarily the only funds we have for children 0 to 5 in our state. And although we generate about $126.6 million that goes out into communities every year, when you consider that we have 550,000 children 0 to 5, that translates to about $225 per child. So that is barely a drop in the bucket to a very state that has a high poverty rate for our children 0 to 5.
Awesome. Thank you so much, Marilyn. Camille, share a little bit about First 5 California.
Absolutely. So first of all, I too want to thank Yvette, and I want to thank for the invitation and to come and be part of this conference today. It's really exciting to be able to spend a few minutes with all of you talking about the good work that's going on both in Arizona and in California, and how we hope that it helps inform the work that the rest of you do. I do want to kind of give a little shout out to our good friend Ed Condon, who's been working to put all of this together. You know, Ed's dedication to young children has helped improve the lives of so many over the years. In other words, he's really old. No, I'm just kidding. He's not. But he and I go way back, and so appreciative of his reaching out. It's interesting when I think about virtual conferences. I applaud you all who are online with us today for really continuing to gather information to improve your practice. And I appreciate the fact that we can do this virtually. And I've seen pictures you've all posted and the ways you are all really trying to put all of this together in a virtual way. Having said that, I miss being in person, okay? I'll just say it. Because I miss those conversations that happen in a hallway. And certainly going out to dinner with new friends and old friends and talking about all that's going on in our nation in so many ways that affects the lives of children. So I so appreciate this opportunity, but truthfully, I'm going to be glad when we're all in the room together again, which I know will happen.
Agreed.
But in the meantime, just to talk for a couple of seconds about First 5 California, as Marley said, First 5 California has been around just a bit longer than the program in Arizona. We have been around about 22 years. It was 1998 when the voters passed the initiative to create First 5 California, and actually a First 5 in every county in the state of California. So we share this good work with 58 other partners across the state. We're designed to educate and support families, teachers, caregivers in the critical role they play during a child's first 5 years. We work around child health and early education, around a lot around public awareness, getting the word out. If you live in California over the last few years, hopefully you will recognize Talking, Reading, and Singing, Talk, Read, Sing, about early brain development and the importance of that It's been a very successful campaign for us, and we continue to focus on that and the engagement from the moment a child is born. So we're very excited about that. I know over in our conversation, we'll talk a little bit more specifically about some of the work that we've been doing over the last year or more. But I kind of wanted to start out a little bit with just a little message. This is a little spot that we're going to air beginning at the end of the month. And it really came to us when we think about all that families are going through to just tackle this COVID pandemic. And we wanted to just give a little bit of optimism, a little bit of inspiration. And so we've got a little ad. I promise it's not going to last any more than an hour. No, just kidding. 30 seconds. Once in Spanish and once in English, or maybe vice versa. But we'd like to share it with you now just to kind of get started. So with that, to our friends who are doing this technology, now's the time.
Tomorrow's healers, makers, educators, tomorrow's uniters, and do-graders, tomorrow's vaccine creators. The promise of a brighter tomorrow is at home with you today. First5California.com. Sanadores del futuro. Creadores. Educadores. Inclusivos del futuro. Y triunfadores. Creadores de vacunas. La promesa de un mejor futuro vive hoy en tu hogar. First5California.com/español.
So great. Thank you so much. I should also do a quick shout out to our IT support here. So these guys are really helping to keep us organized and keep us going. And I just should share with people really quickly that if it feels like it's something is off, we're not on the WAHOVA app, so we're on Zoom. So we can't exactly see everybody, but we're really happy to be here with you all. So anyway, with that, let us move into our discussion because I'm sure people have had a really full day. I think that there's so much going on in the world right now between the pandemic, the protests around racial injustice, police shootings. It's been an unprecedented time for Latinos in this country over the last couple of years. And we're all dealing with these issues around racial equity and racial justice. And so, Camille, I'm going to ask you to respond first, and then Marily, please jump in also. But what role have your organizations been playing to support early childhood providers during this very unusual time?
So I wanting to start out, I think, first of all, talking a little bit about, as you said, just the unrest and the injustice, and that has surfaced up over the last few months around equity and around how we in early childhood and in the work we do have our eye on equity and what we can do and think about it. I think, and so just a couple of things. One is I think we not only keep our eye on it, but we keep both eyes and our whole brain and our whole body on really how we think about it. I think, first of all, it's a lot about education, Yvette, at all levels. From parents, caregivers, to heads of state and policymakers. We really all need to educate ourselves on racial equity, racial, justice, implicit bias, plus just have a better understanding of cultural awareness and really Arizona is probably so similar, but the number of cultures that we in California are lucky enough to be included in, we really need to understand that. So I think there's a real education piece for all of us to do that. It's working with, I think, diverse partners to ensure equity is not just something layered on top. We don't do what we do and then say, oh, we need to think about equity. Equity really has to be woven in the fabric of everything we do and how we think about the work. Yeah. And so it has to be woven in our programs and in our outreach. And so as we continue to develop our systems, we really need to figure out how it is that way and continue to do that. I think finally, striving to create an early childhood workforce at all levels that really exemplifies the diversity in our state, and again at all levels, that we are making sure that that we reflect and understand and continue to improve our work through a diverse staff. And so finally, I'll just say that, we all say often, I think, all children deserve the right start. They really do. And we know that. But our children, who live in persistent poverty, and many of them are brown and black children, they need an extra boost at the beginning. Mm-hmm. And so I think they need the biggest boost. And I think we need to recognize that, and in the work we do, put that forward. So I know we're going to talk about the pandemic in a little bit, so I'll close with that.
Perfect. Marilee, what is your organization doing to support local programs at this time?
Yeah, and I would follow what Camille had to say, and I don't know about all of you, but if I hear the word unprecedented time one more time, I'm going to lose my mind, right? But the year of 2020 has got to go down with more crises than any, in the history of our world, quite honestly, with the pandemic, the civil unrest, the crisis that we have in childcare with our economy. I mean, we go on and on about just all that we're facing at one moment in time, but it does give us a chance to appreciate that we may have been sort of in pilot mode for a lot of the work. Mm-hmm. And as I shared with you, part of our mission is to ensure that all of Arizona's children, that we build an early childhood system that takes into consideration the needs of all children in our state, which is a very diverse state, as Camille has indicated, also for California. So Hispanic children 0 to 5 are our majority, not our minority. 45% Hispanic children compared to 40% white. And we have not as diverse as California as far as other ethnicities. We certainly have a breadth here. I would say that we have done a good job in our early years thinking, just as Head Start has thought about being culturally responsive, understanding the particular needs of children in place and understanding and honoring their personal histories and their family systems and dynamics and their unique culture and traditions and all the things that we think about. But these times remind us, just as Camille beautifully said, that we don't have all of our children starting off at the same advantage point. And the idea that we're just focusing on a system that provides supports for all children may be missing the boat, that resources are most lacking with children of color. And that builds a system of inequities that I think we've been so blind to. So we're doing a lot of work, and I can tell you our community is having a hard time holding back. Our governance structure is a statewide board, and then 28 regional counties is represented of volunteers throughout the state, and they are hungry and ready to get busy. But our board's really taking a thoughtful approach to really doing an analysis, a deep dive of our own policies and practices to look at what things we need to get home. and also to start to engage with community partners on looking at how we begin to address the racial biases and the inequities that we know are baked into the systems that we, very well-intended white people, have created. So this is a new day and a new time, and we're really trying to take a thoughtful approach and work in partnerships with others in our state.
Excellent. So both of you are running agencies that were put forward by the citizens, by the voters of your respective states. You're both have had experience in government, in state government, and so I wonder how specifically your organizations, I'll start with you, Marily, can support systems reform, because we're all talking about systems now. We're all recognizing that the systems as they have been built are intentionally leaving many behind. And so in your agencies, how are your organizations supporting systems reform from both within and outside?
It's a great question. And the truth of it is, here's an advantage to living in a state like Arizona that is highly conservative, does not have a good reputation for being kind to people of color. Yeah. But the advantage we have is we don't have, and we have not had prior to First Things First, an early childhood system. We had disparate, very unique areas. We share responsibilities across multiple agencies in our state. There's not one focal point, if you will, to addressing the needs of children and families. So we're very early on systems building. We're not going to have to dismantle a whole lot of things of that, because we have yet to build them. But I do think, as you're saying, and I think Camille beautifully said, we've really got to take a step back, even in things that we've created like QIRS systems, right? We have designed systems to look at quality. We want to make sure that we're bringing and delivering quality services to children, but have we been as sensitive to the unique nature of our families of color and ensuring that we're not putting them in a disadvantage by pushing an agenda that is traditionally more focused from a white privilege standpoint. So it is, even in the work that we've been doing, and we're really proud of that work. When we started at First Things First, only 23% of the over almost 1,000 centers that were involved in our QIRS system were at quality. Now it is near 80%. So we know in a very short window of time, we're just talking since 2013. So that's a very heavy lift in getting resources to these providers who day in and day out work hard to make sure that they're providing for all the needs of very diverse populations that they serve. But, I attended a webinar recently on QIRS systems and whether or not they have been built with some institutional bias, some racial bias. And so I think that's the exciting nature of our work, to now take a closer look at those systems that we have developed and determine if we need to be rethinking if we're not putting some folks at a disadvantage.
Great, thank you. Camille, how can First Five impact the systems in California? There's so much going on in California.
It's true. So I think there are a couple of ways. Part of what we say is part of our mission is really to be a convener, an agency that brings together both people at the local and the state level to really think about our system and how it works. And so recognizing that, we have been instrumental in working with our partners at the California Department of Ed to really put our quality system together. So Quality Counts California is really a partnership between us, the Department of Education, and other, like the Department of Social Services, anybody who's touching the hands and heads and hearts of young children and their families, trying to really bring that together. and to think about the work we do and breaking down those silos, which I don't know about Arizona, but have existed in California, and we're working hard to figure out how we break that down. I think the other part of that is really looking at what strengths can we, First Five California, bring to the party. So an example would be California is in the process of applying for a federal grant from FEMA to do some work around how to support families during the crisis. How to really do a public education campaign, but talk about mental health issues. And so for us, it is really then coming back with our communication and strategies and what we can do with the work that we have in place to really highlight and put forward this work. So it really is looking at all the work going on in the state and figuring out how we can best leverage that work with each other, how we can look. We are in 2019 in that January budget, the governor, we had a new governor. He likes babies. He likes young children. Very excited about all of that, and he really set off and in his budget invested a lot, nearly, over $2 billion in early childhood. Is great. And he also put in funding for a master plan development. So that is still going on, really thinking about bringing some really smart people together to figure out how we go forward, a roadmap for us. And so that work still continues, although, who would have thought a pandemic would strike and now being able to pivot. And I think for us, that's one of our strengths is we're not a huge agency. We're kind of a small one, so our ability to pivot, some would say as quick as a turtle, but it's quicker than some others. So our ability to pivot and create partnerships where there are natural fits and ability to leverage. I think specifically, and you asked about that, one of the things we've done, especially around COVID, is funding that we had already had in the field for different programs. We went back and looked at it and figured out where's the flexibility. Where can those folks, in this instance, our county partners, where is there flexibility for them to provide to providers additional funding, stipends, supplies, all of those types of things. So really being cognizant of our partners and what they need and developing our programs with them so that really understanding what's happening for those people who are reaching out and doing the work.
Yeah. So states have a lot of work to do in terms of helping to rebuild or build the systems, as Marilee said. But Marilee, just very briefly, what role do you think the federal government has in helping states to reshape, rebuild, implement state early childhood systems?
I think I was just on a webinar. I'm on a lot of webinars. I don't know about you all, but I'm on a lot of webinars and I'm learning things that I could have never gotten to. That's the upside of, the silver lining of this pandemic is we're able to connect with people across the world in ways because we really never get out of our seats. But I was on a webinar with 3 governors, 1 lieutenant governor, and they were talking about early childhood. And they were all saying, so it's not, from me, that the federal government must invest in early education. They must invest in childcare. This is not something that our states are going to be able to accomplish on their own. And as we all know, this pandemic has desecrated and stands to really impact childcare and early education in profound ways. I believe that this may be the biggest childcare crisis in modern history. So we've got to shift the thinking of the federal government in the role that the federal government needs to play with states in partnership with this work. So it can no longer just be about childcare subsidy and subsidies and small grants, right? It's got to be as far as big investments. Yeah. So, and you know, on our side, whether it is focusing on universal preschool so that we can then free up state money to focus on 0 to 3, that's fine. Or if they can see it from a much more broader standpoint, we all know that children begin learning in the womb, and children learn from the moment they hit the ground. And so we've got to become much more educated about the incredible investments that we're making. It was wonderful to hear the governor of Oregon say that she was going to put her body in front of any attempt in her state to defund anything connected to the preschool efforts that they've been putting in place. So to hear a governor say, and multiple governors say that they understand the enormity of the importance and the value of investing early. Let's hope people at the federal level can get in tune with that. We need more Head Start. We've always needed more Head Start. It has taught the rest of us incredible lessons about providing quality care to the children who need it the most. So let's get smart about investing in ways that are going to have the greatest impact. And we know that's low-income children, children of color, children without the resources that their families have. Let's let go of needing to support everyone and focus on those that are going to be impacted most.
Yeah. Camille, anything to add on the role of the federal government in supporting states in making sure equity is built into our early childhood systems?
I think what I would add, first of all, agree with everything Marley has said. So, but I think the other thing I would add, which is a lesson that we're continuing to learn at the state level, is really listening hard to what states are, or in that case, states are saying to us, and building in flexibility to address the needs. You know, California's needs are different than Rhode Island's, and different from, you know, so we have to have flexibility to be able to address the specific needs of our states. And so I would hope that as, you know, the federal government looks at this and again, agree that, you know, the crisis is huge. You know, we just going through the beginning of COVID and looking back at how many children then were without care. How do we ensure that essential workers, there was childcare for those children? We ended up, you know, many providers closing their doors, leaving, we think, as many as 230,000 children who were enrolled in subsidized care without care. And that doesn't account for like the 1.8 million who were just on the list. Yeah. So really, really understanding that parents, it's not just a nice to have, it is absolutely need to have quality child care. And I will say that quality child care so that everyone has the opportunity, all children have that opportunity to thrive, and parents have the ability to go to work and provide for their family.
Absolutely. It's an economic issue too. It's just a nicety. So Marilee, sort of pivoting to the pandemic, states are in crisis, local communities are in crisis, childcare may never recover, won't be the same. Can you tell us a little bit about how First Things First has maybe pivoted some of the work that you were planning to do in 2020?
Yeah, I mean, anything that we were planning to do with a big group is now only happening in a virtual realm. As Camille said, starting off, we miss people. We miss seeing people and having conversations. But for First Things First, again, our revenues are pretty modest as far as the impact that we can have. And we were created because our state has a propensity to dismantle, defund systems that are put in place, especially in the rural parts of our state. We are a very diverse state. We have a lot of tribal communities. We have We have 21 recognized tribes, 19 work with First Things First, but they are on parts of land where you have to drive 5 miles to get to any services, right? So 5 hours, I think I said 5 miles, 5 hours to get to any services. So it was very important to us to ensure that all of the systems of support that had been put in place, that families have come to count on as a result of First Things First, continued. Whether people were able to deliver those services or not during the pandemic, we were not going to do anything to decrease funding, decrease support to the organizations that we have supported. Again, those are services that are critically important. They were selected by those communities as the highest needs in those communities, and so we are making no adjustments to that. Part of it's also, though, looking at what we could do, right? And so one of the things that we did very early on was, as Camille said, helping parents understand how to talk to their children about the coronavirus and getting that out very quickly. We all know that children struggle when they don't have regular routines, that they struggle when there's a crisis and their families have a lot of emotional issues going on. So we were providing parents with the information about that. We were helping link parents who may not have needed services before to critical services in their community. We also very quickly helped our child care and early education programs get access to resources, so they did not have to close if they didn't want to. So over 50% of our Quality First is Arizona's QIRS system, continued to stay open and have been open. Now that's fluctuated. You know, they could be COVID and then they're closed down and then they're back up and then they're closed down. But as you can see, more than 50% of them stayed open. But what was necessary is they had to have access to cleaning supplies, to all the safety materials that they needed for their teachers and others. And as you all know, we couldn't get toilet paper, we couldn't get PPE, we couldn't get gloves. So we rallied to do everything in our power to get them access to those resources. We partnered with our philanthropic partners and our business partners. We did everything from delivering those supplies to centers all across the state, as well as helping educate them sort out what the challenges are from the very confusing information that has gone out to communities as a whole. What do you do? Do you put masks on? Do you social distance? How do you social distance infants? So we've worked really hard to get information out there. I'd say the third thing really quickly too is we've worked to build the awareness of the crisis of our child care and early education system. Although one of the blessings I think that's come out of this is parents now know how hard it is to be a K-12 teacher. They've had to be at home, they've had to been doing lessons, they have to been doing homework, and here's a new awareness that teachers are not sitting around doing nothing. There's also a new respect for why child care, why early education is critical, like you said, Yvette, to the fabric of our communities and to our economies. If parents can't work, then there is no economy, and parents can't work if there is no care and education for young children. So we're build that awareness with our state and national partners. We're pushing hard on those policy areas to get more funding in. I know you're all working on it too, but those are just some of the ways that we have pivoted to use the assets that we have without taking away the funding that goes to 90 nonprofit, primarily nonprofit organizations, to ensure that they do not have to shutter. They do not have to close the doors because they can't pay their staff, they can't pay their electric bills, they can't pay their rent.
Yeah. So you both have mentioned the ability of your organizations to pivot. Camille, you earlier shared with us that First Five has been giving out funds to ensure that local providers and others can get the materials that they need in order to stay open and keep serving kids and families. But Camille, I wonder, what lessons have you learned over the past 3 months or since this all started around how organizations can best serve kids and families and providers?
Sure. I think some of the lessons we've learned are how to listen and try to pivot as quickly as we can, which is not always easy at a state level, but to build on. We too, our commission approved $5 million for supplies to get them out to providers and to families when they on things they need the most, listening to them saying, they said, we don't need toilet paper anymore. We need thermometers, so to be able to pivot and do those things to meet the needs of the field and of families. I think, again, thinking about how our commission is very intent on serving those families who find themselves persistently poor, and what else, how do we really reach out to those families that are hard to reach? And how do we do that? And so thinking of new ways, really working again at the local level where listening and trying to meet their needs, because they are doing that. I think the other thing, two things to throw in. One is, in all of the supplies, and we did cleaning supplies, and we did just like you guys in Arizona did, we also threw in some books. Because you know what? You kind of need something happy in the package. And so as much as we can, knowing how important it is for families to have that time to just, have someone sit on your lap, read a story, talk to them, and sing to them. So we're throwing in some books, and that's a great thing. The other thing is, this week we have just we've done a big refresh on our parent website, and it just is soft launching this week, where it really specifically, you can put in information about your children, the age of your child, and you can find out all kinds of things to do, information on COVID, activities, what's developmentally the typical growth. So you can, as a parent, there's just all kinds of information there. So we're very excited to offer that up to California's families, and anybody else who's listening. You can all go on too. I think you'll like it, to really be a resource. Yvette, it all goes back to relationships.
Exactly. And so they have given me the 2-minute warning, but I do have one final question for both of you, because you've been in the field for a long time, but clearly I think folks can feel your energy, your optimism, and your commitment. And I know that today we've got many teachers and family advocates across early Head Start programs who are joining us. Some of them are dealing with how to support families' mental health and how to support kids' social emotional health. And some of them are probably new to these policy discussions or advocacy. So what words of encouragement can each of you share with these folks out there in the field as they find their voice in doing this important work? And I don't know, who wants to go first? Marilee?
Oh, okay, I'll quickly say, it's such a great question. I mean, there are no experts when it comes to policy. I would say that to you. And Head Start knows more than anyone else that it is the voices of people who are closest to children that have the opportunity to have the greatest impact. Head Start's always known that family parent voices are critical, but it's also the teachers and the family advocates who know the data and know the anecdotal stories that convince policymakers to understand this issue. So please, please, please get involved. Check out your association. We have Early Childhood Day at the Capitol here. All of our Head Start partners are involved. If you haven't done it, please do it. You're going to love it. It's in the spring, and you can get on our website to find out more about that.
Awesome. Camille?
Agree again with everything you said. And the other thing is, it is a bit scary when you first start out, but your stories matter. yours are what really changes policymakers' opinions. So never think that that is not so valuable. The last thing I'll say is, adversity breeds opportunity. It really does. And our systems are being tested in ways we never thought they would be. And there's no clear path with this one. There's no we just don't know. So we have an opportunity now. So we got to take it to kind of find the flaws and really build a better foundation. And that's work we all do together. So onward and upward. Yeah.
Onward and upward. So Marilee, Camille, thank you so much for joining us this afternoon. Thank you for your work and your commitment. It's been a pleasure to be on this with you for a little bit. So I've enjoyed the connection very much.
Yeah.
And to everyone else, a couple of reminders before we say goodbye. So please remember to complete your session evaluations, and remember that the live general session starts at 8 a.m. tomorrow. And so with that, thank you all for joining us today. Thank you especially for the work that you do every day on behalf of children and families across your communities, across your states. And, in the words of Cesar Chavez, just remember, que sí se puede. So thank you all and take care.